Hello, my name is Taejong Sun, Deputy Director at Korea Center for Disease Control and Prevention, KCDC. Korea has improved the quarantine management system as a part of the efforts to reorganize the national quarantine system since the outbreak of MERS in 2015. This course is developed to introduce the quarantine system in Korea, which is upgraded since the inflow of MERS into the country in 2015, as well as the reinforced and flexible entry control system to prevent the spread of COVID-19 as the disease has swept through the world. Also, I would like to share the information on ICT-based health screening for COVID-19 at the point of entry, POE, and how it is linked with the infectious disease control system of local governments. This course consists of the items listed as you can see in the slide, and I will explain you in the following order. First, the establishment and operation of the quarantine system in Korea, which has changed since outbreak of 2015. Second, changes in the number of COVID-19 patients in Korea regarding imported cases, and then how we made an effort to flatten the COVID-19 curve, such as COVID-19 entry screening procedure, special entry procedure, etc. Through the lecture, we will learn how the ICT-based entry screening system in Korea is comprised of and how it operates, entry screening measures taken by the Korean government at the point of entry in order to respond to COVID-19, and the status update on imported cases. Before we move on to the next topic, I will briefly give you an overview on 2015 MERS in Korea. During the outbreak of MERS, which led to the mass infection in 2015, we had 186 confirmed cases, 38 were dead, and 16,693 people were isolated for quarantine. The figures described in the slide represent some meaningful numbers in terms of disease control and prevention activities, and I believe that you can figure out the circumstances and problems occurred during that period. As we failed to screen those infected from other countries to enter Korea, we had to witness several cases of mass infection in local communities. For instance, the 14th patient unknowingly infected over 80 others, and the 132nd patient traveled 600 kilometers to find a negative pressure room for isolation treatment. We had 23 confirmed cases per day, which is the highest, and provided approximately 990,000 personal protective equipment, PPE, to medical institutions, and used approximately 1.5 million N95 face masks. Based on the experience of MERS mass infection in 2015, Korea reorganized the National Disease Prevention and Control System as well as entry screening system of Immigration Office. To improve the entry screening system, Korea revised its quarantine law to handle the quarantine-related data, conduct quarantine investigations, and take proper measures efficiently. To check and examine the quarantine-related information, we have improved the quarantine information system based on ICT. I will talk about this ICT-based system later in more detail. It is noteworthy that the country established a temporary isolation unit consisted of 50 beds, and each bed is for a single patient with negative pressure equipment. We also established a biosafety level, BL3 lab, available to diagnose unidentified high-risk pathogens to reinforce the country's infectious disease diagnosis capability. In addition, we continue to make an effort to raise the public awareness on overseas infectious diseases by using multiple social media platforms and online sites to promote the prevention of overseas infectious disease and communicate with the people, while providing the related information to people traveling overseas through KCDC call center. Since the 2015 outbreak of MERS in Korea, KCDC has established and operated the Smart Quarantine System that links the entry screening measures with infectious disease control and management systems of local governments based on ICT to take the countermeasures against infectious disease from foreign countries promptly. The Smart Quarantine System is designed to compile and check the data on travelers who entered Korea from quarantine inspection required areas by linking the data of multiple agencies, such as incoming passengers' information from airlines, passport information for Koreans of the Ministry of Foreign Affairs, immigration records for foreigners of the Ministry of Justice, data retained at computer systems of the health authorities including Health Insurance Review and Assessment Service, HIRA, for local communities, and roaming records for the travelers from mobile carriers. By using the Smart Quarantine system, KCDC provides the data of inbound travelers regarding countries where they visited to local medical institutions during the COVID-19 monitoring period after they enter Korea to help them check their history of travel upon their visit to the hospital and prescription of drugs so that they can promptly identify any suspicious cases to minimize contacts with others. All travelers who enter Korea are required to have health screening at the arrival hall, including fever screening and health condition. In particular, travelers who enter the country via contaminated regions where a certain type of infectious diseases, such as MERS, Ebola, occurred, are asked to check their body temperature and submit a questionnaire on health condition for quarantine at a hard stand, a paved area where airplanes land. Travelers having any symptoms are transferred to the hospital after checking their health condition. For most who entered Korea from areas contaminated with a certain type of diseases, such as MERS, their information is shared with medical institutions for monitoring during the latent period of the infectious disease. By doing so, medical institutions can check their travel history upon their visit, diagnosis, and medical treatment. In the meantime, SMS notices on infectious disease prevention, asking them to report to KCDC call center upon detection of abnormal symptoms, are sent to the entrance during the latent period. As for MERS, such message is sent for 4 times during the latent period of the disease, which lasts for 14 days to the maximum. Travelers entering Korea from the Middle East, where MERS occurred, are required to undergo entry screening via the Electronic Quarantine Inspection Unit. The Electronic Quarantine Inspection Unit automatically measures the body temperature of inbound travelers, scans the submitted health condition questionnaire and their passports to detect any symptoms from those who entered Korea via the Middle East. The collected data is linked with Smart Quarantine System, and their travel history is sent to the local health center in the region where they stay in Korea automatically. Also, automatic mobile messages with guidelines to prevent infectious disease are sent to the entrants who are subscribing domestic mobile services. The entry screening through the Electronic Quarantine Inspection Unit takes longer compared to that of General Quarantine Unit, which takes 1.5 times longer. However, the Electronic Quarantine Inspection Unit has many advantages to investigate those having symptoms of infectious disease in quarantine stage. As for the General Quarantine Unit, a task to separate travelers having close contacts with infectious individuals from others is carried out manually, and it takes about 4 hours or longer. Also, sending the list of such persons to local governments would take another hour or longer. However, the entry health screening via the Electronic Quarantine Inspection Unit handles these tasks on a real-time basis. Hence, Korea is currently implementing activities to further adopt such electronic unit to conduct quarantine investigations on the entrants from regions designated as areas contaminated with high-risk pathogens. You can see how to work e-quarantine inspection unit via this video. The fever detection camera on the top of the inspection unit measures fever twice in 1 second, and the screening unit collects and manages information by scanning passport and health status inspection. Although not shown in this video, there is a table-typed e-quarantine inspection unit for pregnant women, kids, and the elderly. As for the confirmed COVID-19 imported cases in Korea, entrants from Europe and the US take a large share of imported cases. In addition, more confirmed cases began to be found in entrants from the Southwest Asian countries, including Pakistan, Bangladesh, and Kazakhstan since June. With regard to the people who were confirmed with COVID-19 among travelers entering Korea from overseas, the shares of imported cases from Europe and the US account for 30% and 37%, respectively. Also, the share of imported cases from Asian countries excluding China amounts to 30%. The proportions of Korean nationals and foreigners in imported cases were identified as 77% and 23% for each. As of June 30th, there are 1,598 confirmed cases in Korea, infected by those who entered Korea from overseas, since the country found the first of such case, which was imported by China on January 19th. Among the 1,598 persons, 729 inbound travelers were tested positive during the entry screening procedure and isolated for quarantine and treatment. The remaining 869 persons were confirmed to be infected with the virus in local communities. We were able to avoid the inflow of COVID-19 to the community by detecting approximately 46% of imported cases during the entry screening, contributing to preventing further spread of the disease. For instance, we have conducted over 20,000 COVID-19 diagnostic tests at airport screening stations on inbound travelers showing symptoms upon arrival during the same period. As for the number of imported cases of COVID-19 in Korea, patients infected with the disease were mostly from the US and Europe in the beginning of the global COVID-19 pandemic. However, we are now seeing more cases imported by those from countries in the Southwest Asia. With regard to nationality of COVID patients among the entrants, more Koreans entering the country were infected with the disease than foreign entrants in the early stage. But the share of foreigners entering Korea with the disease has increased gradually since May. Thus, we believe that we should strengthen the management and control measures on foreign travelers entering Korea from countries in Southwest Asia and others upon entry screening. As I mentioned earlier, we have implemented various quarantine measures flexibly according to the severity of risk on the entrants, including special entry procedure, diagnostic tests, self-quarantine, etc. As a result, the share of confirmed COVID-19 imported cases per 10,000 entrants from European countries has declined significantly after peaking at 171.3 people by the end of March, and the share of those from the U.S. has decreased since the early April, with the highest number of 89 persons. In May and June, the share of COVID-19 imported cases per 10,000 entrants increased in case of those from Latin America, Southwest Asia, and Northeast Asia. Hence, we have reinforced quarantine measures by implementing diagnostic tests preemptively in the entry screening procedure. We applied flexible disease prevention and control measures in various types and levels, including designation of quarantine inspection required areas, special immigration procedure, and diagnostic tests in consideration of the status updates on COVID-19 in Korea and overseas, changes in the number of inbound travelers, and the occurrence of COVID-19 victims infected by foreign entrants. For instance, we have designated China, which accounts for over 90% of COVID-19 confirmed cases across the world, as a quarantine inspection required area in January 2020, and adopted special immigration procedure on February 4th for passengers entering Korea from China. As the number of COVID-19 patients increases in Europe in March, we applied the same measure to major countries in Europe on March 15th, and decided to conduct diagnostic tests for all passengers from European countries on March 22nd. For entrants from the U.S., all passengers from the U.S. are required to isolate themselves for 14 days from March 27th, and the scope of this measure has expanded to include all passengers from countries across the globe since April 1st. Starting from May 11th, we are carrying out COVID-19 diagnostic tests to all passengers during the monitoring period. Also, we requested all passengers to undergo diagnostic tests within 3 days from the entry. Korea has been operating a strengthened and more flexible quarantine system for inbound travelers since the COVID-19 outbreak in China is reported and amidst the global coronavirus pandemic. All travelers arrived in Korea are allowed to enter the country only when they undergo health screening via the special entry procedure while submitting the questionnaire on their health condition and installing the Self-Health Check app or Safety Protection app for self-quarantine. Those who are identified to have symptoms should undergo a COVID-19 diagnostic test at Incheon Airport National Quarantine Station and transfer to hospitals or temporary treatment centers for isolation and treatment if they are tested positive. Those who are tested negative should be under self-quarantine for 14 days at home in case of Korean nationals and long-term travelers, or at temporary residential facilities for short-term travelers. Travelers without symptoms are required to stay at home for 14 days for self-quarantine in case of domestic residents and long-term travelers, and all entrants should receive diagnostic test within 3 days of entry. After that, they are administered to the hospital or required to stay at home for self-quarantine based on the test result. As travelers comply with the COVID-19 entry screening procedures, short-term travelers without symptoms are required to stay at temporary residential facilities for 14 days. Also, all short-term travelers without symptoms should undergo a diagnostic test at screening stations in the airport or temporary residential facilities. Those who are tested positive are transferred to the hospital or temporary treatment center. The entrants with the self-quarantine exemption certificate, issued to diplomats, government officials, or with the ones issued by Korean embassies or consulates for their visit with academic, public interest, and humanitarian reasons, are first required to undergo a diagnostic test at screening stations in the airport or temporary residential facilities, and wait for the result at the temporary residential facilities. Although persons tested negative are exempted from isolation, they are subject to active monitoring to check their daily health condition. Korea has introduced special entry procedure to all passengers from countries across the globe since World Health Organization (WHO) has declared the global COVID-19 pandemic on March 19th. The special entry procedure requires all entrants to Korea to submit the travel record declaration with the address in Korea and contact information, and such information is verified at point of entry. According to the procedure, all passengers are allowed to enter the country only when they install the Self-Health Check app through their mobile phones during the entry screening. Those who enter Korea should monitor their daily health condition and report whether or not they have a fever, cough, and other symptoms for 14 days during their stay through the Self-Health Check app. If an entrant reports to have symptoms, an alert is sent to a team designated to monitor the app to help the entrant consult with a doctor or undergo a test. With this app, we were able to conduct diagnostic tests and quarantine suspected COVID-19 patients for quarantine and medical treatment promptly in cases where they showed no symptoms upon the entry during the latent period and began to cough, have a fever, and other symptoms in the local community, improving the capability of local community to control and manage the infectious disease significantly. Korea has made an effort to establish a paperless quarantine inspection process with apps, starting from the entry screening with the help of ICT. As an approach to develop the paperless quarantine inspection process, we are planning to improve the system and devices, allowing passengers entering Korea to install the Self-Health Check app to register and submit their quarantine-related information. Through the system, the entry information and health condition of entrants are encoded in QR code for automatic entry declaration upon arrival, and the information is sent to the local health authorities in the area where they stay in Korea to check their health condition, and information related to control and prevent infectious diseases are automatically linked. Korea was once the country with the second largest number of confirmed COVID-19 cases in the world. Now it has become an exemplary model in terms of the prevention and control of the infectious disease, owing to the measures taken to counter the disease, including proactive diagnostic tests in local communities, tracing persons having contacts with infectious individuals, and isolation of COVID-19 patients for quarantine and medical treatment, and other methods to minimize the inflow of persons confirmed with the virus from overseas. I believe that it was the result of voluntary public engagement and sacrifice of social distancing based on the matured citizenship and dedication and commitment of medical staff. In closing, I would like to express my sincere appreciation to Korean citizens for their efforts and healthcare workers for their service again.